So I'm going to do a medical patient assessment, BSI, scene safety. All right, so based on my dispatch information, it seems like I have one patient that has difficulty breathing, some kind of respiratory disease. So this is my only patient. All right, so right off the bat, I'm going to request additional ALS support, ALS ambulance. Okay, so my general impression, this is a 20-year-old female sitting in a tripod position, having difficulty breathing. And as I walked in, she was sitting here, alert and conscious. So I'll give her an A for level of consciousness. So my name is Rusty. I'm with the ambulance. What seems to be the problem here?
My chest just feels really tight.
Okay, so it seems like you're having some kind of difficulty breathing, right?
Yes.
Okay. So the chief complaint is difficulty breathing. First thing I'm gonna do is move through my ABCs. A airway, B breathing, and C circulation. So I'm gonna use a stethoscope. As I listen to her, I can hear air moving just fine. Do I hear stridor or anything? No, I don't. She's breathing, her breathing rate is 24 breaths per minute. Okay, so the air is moving well enough. So I would assess her respiratory rate, which is 24 times per minute. So I'll listen to lung sounds, and can you please take a couple of deep breaths for me? Okay. Okay, last one. Okay, so it sounds like here are wheezing sounds. Alright, so based on that, I'm gonna put my patient through on a high flow oxygen, 15 liters per minute. And I don't have anything, actually I don't have actual oxygen, so I'm gonna verbalize it. Okay, so we're gonna move to circulation. First I'm gonna check her pulse. So what's the pulse rate? Pulse rate is 96 beats per minute. And I also watch for any major bleeding. There's no major bleeding. So the only problem is difficulty breathing. I'm moving on to inspecting the skin. I see that the skin is pale and there's no cyanosis anywhere. Okay, so do I notice any cold or warm temperature? No, temperature seems fine. So I'm gonna move ahead and make this a priority patient. I'll try and transfer her as quickly as possible. So next, I'll move on to my OPQRST. So, onset. How long did this start?
About an hour ago.
Okay, what were you doing when this started?
I was just watching TV.
So you're just sitting there watching TV, nothing extra happened.
Yeah.
Okay, and can you describe the feeling for me?
Yeah. It just feels tight in my chest.
Okay, and on a scale of 1 to 10, what would you rate this?
About an 8
Okay, and again, how long have you been feeling like this?
for an hour.
Alright, so after I'm done with my OPQRST, I'll move on to my sample and try to get a little bit more information on the patient. Do you have any allergies?
Yeah, I'm allergic to penicillin.
Okay, so she's allergic to penicillin. Cool. Are any medication?
Albuterol.
Albuterol. Okay. And past medical history?
Asthma.
Asthma. Oh, that's probably what albuterol is for. Okay. And what was the last oral intake? Maybe you ate something?
Well, I had breakfast this morning.
Okay, so that's okay. Just breakfast in the morning. And what are the events leading up to this? Again, what were you doing?
Just watching TV.
Just watching TV. Nothing extra going on. Okay, so I'll move on to my secondary assessment now. For this patient, I really want to listen to lung sounds again, reassess, because that seems to be the only problem here, chief complaint. So take a couple deep breaths for me. Okay, again. Okay, one more. All right, the last one. Okay, so I still hear some wheezy sounds, but it seems that my patient is breathing better now. The oxygen helped her. So now I'll check her vital signs with the secondary assessments. First, I'll check her pulse again, and I'm checking her pulse. Now it's 90 beats per minute. Okay, and the respiratory rate is 20 breaths per minute. So it seems like the respiratory rate has gone down, as well as pulse, but now pulse is still kind of high. So lastly, I'll get her blood pressure. So I'll put a BP cuff right here, and I'm checking her blood pressure. Her blood pressure is 112/70. All right, so now that I got her baseline vitals, and my field impression of the patient is that she's having an asthma attack. At this point, I'll do interventions. If she had her albuterol inhaler, I'll assist her with that. After that, I'll just wait for the ALS ambulance and keep reassessing her, checking her vital signs, like respiratory rate, pulse, and blood pressure. Narrator says, at this point, ALS ambulance arrives. So when the ALS ambulance arrives, I'll give my report, my summary to the ambulance. And so this is a 20-year-old female with chief complaint, difficulty breathing. She has a past history of asthma. She has an albuterol prescription for asthma, allergy to penicillin, and last intake was breakfast in the morning. And she was just watching TV when it happened, so nothing led up to this. Okay, and there's nothing else I'd like to do for this patient. When the ALS ambulance arrives, I'll just transfer her. That's it.